What is the difference between dry needling and acupuncture? I get asked that question all the time. It's a great question. So I have a lot of patients that will say, oh yeah, I have had acupuncture before. I did some of that with my physio. And I say, great, I love that one, they've had an experience of needles in their treatment. But then I sort of need to explain that the intentions between dry needling and acupuncture are pretty different. So someone who's doing dry needling and someone who's an acupuncturist, we're using the same tools, we're using the same kind of needles. They might be slightly thinner or slightly thicker, depending on what we're trying to do. My understanding of dry needling is that it's a branch or a subcategory of acupuncture. Generally speaking, people that are practicing dry needling will be using the needles into a local area of tissue that has a problem. So somebody might have pain in a tendon area, somebody might have a muscle that's really sore and stuck and tight. My understanding is that a dry needler would put a needle into that area to try and get things to shift. And they'll be stimulating that area pretty strongly, trying to get a muscle spasm reaction. Versus acupuncture, where the application is much broader. So we can definitely use the needles in a Chinese medicine context to clear pain, but we also are using it to stimulate energy. We're using it to support the internal landscape of the body. We might be doing it to help support the mind. We might be doing it to help improve blood flow. We might be doing it to help support the organs, digestion, the heart, the kidneys. So possibly a local site for a dry needler will really be muscle specific. But an acupuncturist might be using the exact same spot, but not for the muscle. It might have something to do with the gut. That point might have a function for the stomach. That point might have a function for the heart. That point might be along a particular meridian that we're trying to move in order to resolve a buildup of damp or phlegm or heat in the body. So the way that we use the needles can be a little bit different as well. Sometimes people will remark that the dry needling was really, really painful. And then there'll be an anticipation that the acupuncture will be the same kind of intensity. It might be, depends on what we're trying to do, but it could be a lot more gentle. For myself, if I'm dealing with musculoskeletal pain, I often don't needle the point that's sore. So if someone comes in and says, I've got a really sore shoulder, I'm probably not going to put any needles in the shoulder. And I have to manage that well, because people will say, what are you doing? It's my shoulder that's sore. They may not say it like that, but they might be confused because I'm not needling the area that's painful to them, because I'm looking for another point somewhere else in the body that relates to the shoulder, so that when they move their shoulder, we can see if we've made an improvement. And there's lots and lots and lots of different theories and schools of how you can use acupuncture. It's done in Japan, it's done in China, it's done in Korea. There's lots and lots of different methods of how you can do that. An acupuncturist has studied for a little bit longer than somebody who's using dry needling as an extra ancillary therapy in their modality. So that's a little point of difference as well. So they're definitely related. They are siblings of sorts. But I would say that dry needling is a subcategory of acupuncture, and that dry needling really does focus on the musculoskeletal system, whereas acupuncture is a whole entire medicine of itself that can treat everything in the body, can support the whole system of the body.